You all ready to join me today in our trip to outer space?
Yeah.
Albert Shivers.
The Matrix doesn't happen.
That's very true.
Come along quietly or not.
Goodbye, Whips.
As I was about to try to bribe
From Albert
the
Shivers.
mistress of the fading light.
They don't have to like it.
They're trying to put a caravan.
The general concept is that creativity flourishes in an atmosphere of freedom.
All right, folks, welcome to another episode of the Planet Shivers podcast. This is Albert Shivers, and for the third time, I'm excited to welcome Ella Steinbeck onto the show. Thanks for coming on, Ella.
Hey, thanks for having me again.
So, if I urge all listeners to listen to the first and second episode we did together a few years ago, we're going to be picking up a little bit from where we left off with those and throwing some new topics in. So the first thing we were planning on talking about is inspiration porn. And for folks who don't know what that might be...
Well, it sounds way more exciting than it is.
Yeah, that's true.
It sounds like we're offering an X-rated experience.
Yeah.
But we are not.
We can, if we call the episode that, we'll get some good clicks.
Yeah. Anything with the word porn in it, right?
Yeah. But what exactly, give it a little bit of a definition or explain a little bit what that's like or what it is.
Right. So inspiration porn is basically when you see someone who has a physical handicap or some kind of developmental issue and you're like, wow, if they could do it, then I should be able to do it. Or, wow, look at them, good for them. Or, even like if I've heard parents talk about a newborn who maybe didn't come out in their eyes perfect, which even if you have a disability or something, you're perfect just the way you are. You are the way you are, right? There's nothing wrong with having anything wrong. Because people say it's wrong. It's not wrong. You're made the way you're made. And people will like, oh, well, we'll still love her as much, or him, or, the child. We'll make sure she, has this or that. It's like they're already saying and undermining someone's ability to just be themselves, basically. So as if that handicap is supposed to be an inspiration to other people is totally gross, kind of.
Right.
And I can understand. People think, oh, that guy doesn't have a leg, and look how he gets around, and I have a bad hip, and it's hard for me to walk down the block. Okay, but it's not the same thing. It's like he's not there to inspire you.
Okay.
Or, so that's what inspiration porn is.
Do you think that it's, thinking about it, I tend to notice that it can all be very similar and leave certain elements of being disabled out of the equation, because it always ends up being the pinnacle of it. The man with no leg runs the triathlon. It seems like it's like somebody making it all the way to the top. It's never like this person got over it normally. It's like this guy swam the Pacific, dodged sharks, rode a whale. It's always very grand.
Yeah, a lot of times it is grand, and it's like, okay, well, he did that. That is great for him, and it's great for anybody who does that. It's not great because they had with all your whatever blessings, all your 10 toes and 10 fingers, whatever it is, it's not there to make you think, oh, I should have been able to do that. It's not what it's there for. Just be glad that, or excited someone swam that far or ran that far. Just be glad of that. I don't, it's not there to make you think you should have done more, or have some kind of like, oh, bless his heart kind of reaction. That's not its purpose.
So do you think it's can be degrading at all?
Well, I mean, there's a certain objectification in it, right?
Okay.
Now you've turned a person into an object. And that's why it's considered inspiration porn, is because we are objectifying these people instead of humanizing, right?
Okay.
So they're not there for your reaction, your whatever.
Mm-hmm.
That's basically.
So have you seen and experienced inspiration porn when it comes to chronic illness?
You know, that's what's interesting about chronic illness. I was thinking about this quite a bit, and a lot of us have invisible disabilities, and it's this strange dichotomy, because a lot of times people don't believe there's something physically wrong with us, and we do take wheelchairs at the airport, and you know, a lot of us can't stand very long or walk very far. See you as someone who needs help at times. And so this isn't about like not helping people, help them. If look, there's lots of people who are perfectly fine getting around themselves, even though you think they look disabled. They don't need your help, right? So you can ask somebody, you know, do you need me to get the door for you? But don't just assume someone needs that, right? Like, we can't just make assumptions, because that can be very destroying just to your sense of self. Like, a lot of people don't want to walk around looking like they need help, right? They just want to be seen as anyone else is seen, right? So it's a little different with people with invisible disabilities or chronic illness that isn't apparent, because people don't believe you at the airport. Like, I can't tell you how many times I take a wheelchair and people assume that the only reason a person should be in a wheelchair is because their legs don't work. Like, there are a million reasons you may need a wheelchair at the airport or anywhere that has nothing to do with your legs not being operational, right? You can be someone who has vertigo. You can be someone who faints a lot. You can be someone with a heart problem. You could have, you know, lung issues. You know, you can have POTS, you know, postural orthostatic tachycardia. You can have any type of dysautonomia that makes it difficult to stand or walk. You can have foot pain. You could have been in a skiing accident. You could have just had surgery on a part of you that isn't apparent to someone. So sometimes in those situations, it's important that people see something visual wrong with you, so that they do give you the help you need and don't do the eye rolls, don't push into you. Like, I've had people, even using my cane around the city, you know, push into me. I think we talked about that before. But I had a bus driver close the bus doors on my cane as I was getting onto the bus. I don't know why. I mean, I guess because do they think I'm just carrying around a cane because, I mean, it's not even a fashionable one. It's like, you know, I'm like going around the city, oh, look at my cool cane. Right. I was like, it's actually just a regular cane. But sometimes in those situations, it is important because I do need help, right? So when I'm at the airport, it's important that there's something visual on me that people understand, oh, she may need assistance. But not everyone feels that way, right? We're all different. Like, we're all different. So it's important to ask people, you know, do you need assistance? Would you like help with this? You know, don't just assume because a person looks a certain way that they're fine. And don't assume that someone who looks a certain way isn't fine. Like, I think it's important that we make that distinction and ask people, you know, questions. Or wait for them to ask for assistance. Like, it's not all or nothing, right? I mean, it's hard to say what's right for one person isn't right for another. So I can't say that all people who objectified, like it's not those two they're not associated,
Mm-hmm. Would you mind the feed froze there for a second? If you wouldn't mind saying what you just said back, because I feel like it was a good point and it just froze right in the middle.
So I think there's an important distinction between, what did I say about someone needing help? Hold on. Do I start with not everybody who looks like they need help needs help.
Mm-hmm.
And not everybody who looks fine doesn't need help. And neither group of people necessarily means that I can't remember.
That's all right. So as we were talking, I was thinking with invisible illnesses, and I experienced a very small bit of this in the time when I had Lyme, and I still feel like certain things pop up here and there, especially working more physically now. I feel like the little gremlins jump out every now and then. But I found myself, even in that short time, getting a little bit defensive with people who were brushing it off, maybe, or say, well, you look fine.
They think you're faking it.
Yeah.
Like, why would I be faking this?
Like everything from whether it was some friends or even family. So now, I've not really dealt with it like in the public sphere, but what is your experience in that regard? Of like, do you find yourself being defensive over, or maybe like, what am I trying to say here? Like getting defensive over your condition just to prove the point of like, hey, I'm not as able as everybody else.
It gets frustrating because if I'm out with people I know, a lot of times they forget. So it gets humiliating to have to remind someone, look, I can't walk the 6 blocks that you think we're about to walk. Like, we need to get in a cab. And they're like, yeah, but it's only 6 blocks. I get that it's only 6 blocks, but I don't have that privilege of walking 6 blocks. So we need to jump in a cab. So that can be hard because it's not something, and see, that's the thing. Okay, that's the other like kind of side of Inspiration Born, is that I'm not here to make you comfortable with what's wrong with me either, right? Like, when there's something wrong with someone, we feel there's a certain expectation that we're supposed to be like everyone else. You know, I say that in air quotes.
Right.
Sorry for anyone who hates air quotes. But, you know, it's like you try to look as normal as possible, right? You want to blend in. You don't want someone to feel sorry for you. You don't want someone, whatever. So you try your best to be regular. I'm just going to air quote the hell out of this.
It's fine.
Because I don't know how else to say it, right? Because all these words are not even politically correct words for us to be using this day and age. But this is how people talk about it, right? So using verbiage that is normally used. But, you know, so there's that one side of you that just wants to be seen as everybody else. And so you shift your appearance, you try to hide your mobility aids, you, even me, when I wear my wrist guards, you know, I dress them up with ribbons so they don't look so orthopedic. You know, I wear orthotics and shoes. I try to get shoes that fit the orthotics and look nice at the same time. You know, I've been wearing support hose for 27 years. Try to wear outfits that don't make the support hose look noticeable. I don't want people to know that I have all this stuff going on underneath me, but I have to take care of physical issues this way. And even with a cane, like, you don't want to be seen as a person with a cane. Like, it feels embarrassing getting out of the cab, or people look at you and they think of you in one way because you present a certain appearance, and then they're like, oh, that's too bad, and it's like, what's too bad? It's just how I get around. If you break your leg or you have back pain, do you want people to be proud of you for getting to the office because you hurt your back? I mean, maybe.
Right.
Maybe you do. But it's like that. It's like, I don't need someone to be, proud of me for, getting from point A to point B. But at the same time, if I can't get from point A to point B, don't be weird about it. Just say, okay, we'll get in a cab. Don't ask me 60 questions about the 6 blocks
Right.
that you can walk easily and I cannot. It's kind of like that. So yeah, with chronic illness, it's harder because people do think you're faking it, or you're trying to get attention, or you just want a day off work, or they don't understand until it happens to them.
Right. Yeah, I think that's the truth of it, is even if it happens to them a little bit. Now, my a friend of mine's grandfather, who's very, very active out in nature, does a lot of like preservation stuff, does hikes. He's a cool, active old dude, and he's been on the podcast. But he recently got Lyme again, and he's had it many, many times. And with him, like, it's never lightly because of his age. And I believe, I don't know if I'm getting the timeline totally right, but about the last time he had it, it was affecting his heart, and had his
Lyme carditis is a real problem.
Had his partner not like caught on to it and got him to the right help, it could have gotten much worse.
It can kill you.
Yeah.
Yeah, for sure. That's scary.
So it is, and I spend time out doing walks and hikes and things, and when you are telling someone about it, like I can, what I'm driving at here is I can get pretty obsessive over, like, okay, we're in the woods now, go home and just shower for a half hour and just look over and look over and look over, because even even that can be like picked on a little bit. I've found, whether it was this 80-year-old dude who just wasn't feeling right, and if you brushed it off, I mean, as like, oh this, oh that, oh you just did too much at your age, and I've found there's so many ways that people can brush it off, no matter who they're speaking to. It's so easy for them until, like you said, they experience it for themselves.
Yeah, until it happens to them. No one understands. Like, it's hard for me to use my phone. Like, my thumbs hurt, my wrists hurt, whatever. People are like, it's just tapping. Can't you just tap out a text? And it's like, well, sometimes I can't.
Mm-hmm.
And it seems crazy to people. But that's what ableism is, right? There's this term ableism, and it's able-bodied people really not being able to imagine not being able-bodied, or putting characteristics onto someone who isn't as able, onto them. Like, there's so many words being thrown around, and to me, the most important part of all of that is just that we listen to people. Like, where's our humanity in all of this? Just listen to what people want. People want different things. Not everyone's going to be in one category, right? If someone wants to tick-proof themselves when they walk out on a hike, don't make fun of them because they don't want Lyme disease again. or you don't believe Lyme exists, because Lyme does exist, but it's not up to you to decide what I do with my body and how I protect myself or make myself comfortable or whatever. It's no judgment on somebody else, you know?
Yeah.
It's just what I need to do for me. But I also don't want to be judged for what I need to do for me. Just like wearing sunscreen. You know, some people like to get a tan. Other people don't want skin cancer and wear sunscreen. But you'll see people make fun, oh, you're going to put on all that sunscreen, wear a hat, sit under an umbrella. You know, why even go to the beach? Well, because I love the beach. I just don't want melanoma.
Right. Yeah. Yeah. And, yeah, I even remember, like, one thing that we talked about discussing on this was, like, the cost of disability and how it is even different per gender. And I would, in this, you know, I don't know if this is crocodile tears or not, but I would even say I experienced things, when I was in, like, the throes of Lyme and everything was hurting, where I got a lot of the, like, man up, kind of like, oh, come on, don't be weak, come on, like, cowboy up, all those terms.
Right.
And that could even be, like, you talk about people not understanding either because they won't understand.
That's ableism,
yeah,
right? That's ableism.
They either won't understand, like, you can't make them understand, it's a lost cause, or just because they haven't experienced it themselves and don't realize, like, whenever that had happened to me then, I don't know if you've ever had the same thought with people, but I've gotten to the mindset of, like, speaking internally but to them, like, you have no idea how much everything can screw up. Like, you don't even think about not being able to text. The average person, it wouldn't even dawn on them. Like, there's so many ways that things can be hard on you and hard on us or hard on anybody that folks just don't consider and don't have much empathy for.
Right. Well, empathy is a big thing. People do not have a lot of empathy and they cannot put themselves in someone else's shoes. I'm not quite sure how we got that bad, but yeah, as far as a gap in expenses, you know, there's being a female, of course, is way more expensive than being a man because there's all these extra supplies we have to buy being a woman. But then with disability or chronic illness, yeah, we have to take the cabs. Like, it costs so much money. You know, people don't realize if they're not from New York City, but for me to get to Midtown and then get back, let's say to go to a doctor's office, I'm spending, you know, like $30 each way. If I have to go downtown, like 25th Street, it's going to cost me about $60 to get there and $60 back. I mean, to be disabled in the city is hard, and people say, well, but you can take the bus. Yeah, but then I have to walk to a bus stop, and then wherever the bus drops me off, I'm going to have to. So sure, maybe I can make the taxi time less, but it's also very difficult to navigate all those things. And sometimes an area of the city doesn't have cabs, you know, and you're just sort of stuck there. I mean, you can use your curb and you can try to track down a cab to, you know, sort of like a Uber. I don't use Ubers because most of them have fragrance, and I have severe fragrance illness. Like, at this point, I have an EpiPen. Yeah, because all those Glade plugins, the trees, if they use, oh my God, Fabulosa, that cleaner.
Yes,
or
I'm
Febreze.
familiar with that.
Yeah, you might as well just kill me now because, oh my gosh, I get so sick. And people don't understand that either. And, you know, it's these minor things that are environmental illnesses that people are probably reactive to and they don't even know. But just the expense of, sometimes I get in a cab and I realize I'm going to get sick in here. I'm way too allergic. I have to get out of that cab, go find another cab. Like, it's just such an added extra that most people take for granted and will never have to experience. But there's a population of us that exist out here, and for whatever reason, we need accommodations, and we don't need judgment, and we're also not, you know, supposed to be inspiring either.
Do
know?
like one thing with I can imagine also in regards to like having to take the bus of you run so there's the steps to get into the bus. You never know how crowded the bus is going to be.
Correct.
At least with with a cab you're solo. And you don't have to worry about, like you said earlier, people bumping into you or just the average person not being considerate. So I can imagine that factors in, too, to your decision to get from point A to point B.
Well, yeah, because it's been a problem because I need to sit, I can't stand, and since I look normal, people think I just want a seat.
Okay. Right.
They assume I'm just some jerk who wants to take their seat and they won't give it to you. I've had to, one time there's 3 buses came, all full, and I got on the bus and I said, hey, I know I look normal. I look fine. I'm not fine. I cannot stand. Would anyone please give me a seat that can stand and doesn't mind? And I had to shout this on a bus, which takes a lot of guts.
Yeah.
And not one person got up. And that happened on 3 buses. 3 buses. Not one person. Not one gentleman. Not one lady. Not one teenager. Not one person would get up for me. What's that about?
Lack of empathy, like we said before, I guess, or just not believing you for whatever reason.
Yeah.
So I imagine.
It was so crazy.
So I imagine like you don't do the subways, right? Or do you?
No, I don't. I mean, there was a time where my ankles and hips weren't as bad as they are now, and I was able to do the subway, which was great. It's a great way to get around the city, but there's not enough elevators, and it's hard to get over to the subway. I mean, you're going to have to take a bus or a thing, and the city has made it. I just want to say this, I know this, but the city, if Mayor Adams or Kathy Hochul is listening, or any mayor in the future,
we'll get it to them.
Yeah, it's like they have made the city so hard to get around that people with disabilities are so unwelcome at this point. It is hard first of all, it's bike lanes or bus lanes. So for me to go out and get a cab and flag it down without getting hit by a bus or a bike, it's like if I wasn't disabled before I went out there, I will be any minute now because they're just coming at me and I'm trying to wave down a cab and, not die. They've made it impossible, and they've shut down streets, so it takes us longer to get anywhere, so those taxi rides cost more. I mean, it is just... Oh, and then they do the public streets on the weekends where they shut down whole streets where you can't drive down them. Well, guess what that means? That means I can't drive down there and get there.
Right.
Because I can't walk down there, and if I'm in a car, I just have to go back home because now it's too far for me to get to. So I just wasted all my time and money to try to get someplace that you've blocked off and the car can't drive down.
Is the public streets, is that a new thing?
No, they've been doing it. It's like these open streets, so it's like they close them off so people can, I don't know, walk around, play a baseball game. I don't know. I mean, it's like take their kids in a stroller because I guess we don't have enough sidewalks on the weekends. I don't know. It's really frustrating. And nobody thinks about the impact on the population who cannot walk or ride a bicycle to get to certain places.
Right. While we're talking about the city, I'm always curious how things are going down there. Has there been much, being from there, there's always a part of me that's still there. If not, like, mentally, there's a piece of me that's always down there. So, has things changed a lot to your perspective in the last several years? Because, I hear, especially being up here in Pennsylvania, I hear a very one-sided filter of what's cooking in New York City. So, from your perspective, and I know it's a unique perspective, but from your perspective, Has it changed a lot to you in the past couple of years?
You mean like because of COVID, or you mean? I mean, they say that violence has increased. Attacks on. Although they say it's down, but I feel like either the news tells us way too much, or violence is happening more often than it was. I
Right.
can't figure it out. They say attacks are down, but it seems like they are up. And to me, the city feels more scary. And when you're part of the vulnerable population, you feel more vulnerable thinking, what if someone attacks me? I don't want to be more injured or have, there's a certain trauma that goes along with just being part of a vulnerable population.
Mm-hmm.
So I feel less safe in the city. I don't, I'm really aware of what I bring with me so it doesn't look like it wants to be stolen.
Mm-hmm.
That kind of thing. And we have all these outdoor eating areas now that we didn't used to have, and a lot of people are just getting mugged right in broad daylight while they ate, lunch, or at night they would eat dinner, and it's real easy for someone to walk up to you and say, "Give me your watch,"
Right.
"Give me your purse.
Yeah.
How much money you got on you? What are you gonna do?"
Yeah, and I guess that's what I was getting at, because a lot of the news stream that flows up this way is mostly pretty negative. And I know well enough to know that, but also like people who are actually there seeing it. Like the stream can be one-sided and a little bit propaganda-like. But I've always wanted to speak to people who are there, like living it, every day.
Yeah,
Is it really that bad, or is it?
I mean, maybe it's not, but boy, a couple years ago, there were so many carjackings,
Okay.
and it would happen even, on like 55th Street, 56th Street, 52nd Street. Like, these are busy areas,
Mm-hmm.
and carjackings were happening like every day. You would see one on the news, and it would be in an area you just drove through, and you're thinking, oh my God, I was just there. Like,
Right.
it could have been me. That's what it feels like. It feels like it could happen at any time. That's how I feel anyway, But I know people who lived through, the 60s, 70s, and say how
Right.
much worse it was. The city was just on fire, and, it was so dangerous to walk through Times Square, or Central Park, for that matter. I mean, so I guess it's not as bad when you talk to those people, but I haven't been here that long,
Right.
So,
Gotcha.
yeah, I didn't live through those years. So, yeah, no, to me it feels scary. Even the protests that we have going on right now.
Mm-hmm.
The city sort of has felt like it's on fire since, the George Floyd protests, and then now we have, war protests, and, it just creates a certain level of chaos in the city that puts you on high alert.
Does it feel like there's more tension in the air down there?
I mean, does there? I don't leave the house a lot, so.
Okay.
Well, because you're not quite sure what side people are on for really anything.
Mm-hmm.
But I think that's more of a political, statement than personal safety, I guess.
Right. I gotcha. Yeah, I was just curious about that from someone whose boots are on the ground down there. So,
Yeah.
going back.
I spent, yeah. Oh, no, go ahead.
No, please. I was going to bring it back to what we were talking about, but go ahead.
Well, I spent, 11 months away in a clinic trying to get better, and, you don't stay in the clinic, you stay in an apartment or, whatever you find. But I can say different parts of the country are certainly different.
Right. So,
How they...
Yeah, that's
with
definitely true. So you had brought up the clinic to me. I'm a bit curious about it. You tell me whatever you want to tell me about it. But could you say where it was in terms of like?
I probably prefer not to.
Okay.
But I did. I was at a clinic trying to get some help for my pain, hoping I could relieve some of it because functionality wise, because right now I'm really just on a whack-a-mole of pain management.
Okay.
I have certain doctors I go to for radio frequency nerve ablation in my spine. Never steroids. I never get steroids. But we do, burn nerves in my spine. I get deep muscle injections to relieve spasms, and it's just not sustainable, though, right? I never get sort of a full body recovery. So I thought, okay, I'm really going to immerse in rehabilitating my body because getting around the city is so hard. So to get to the right PT, to get to the right treatments that I need, I can't do it all because I can't get around that easily. I can't get to point A to point B, 5 days a week, 4 days a week. It's just so hard, this city. So I decided to go away for that treatment. And
was this something that you were thinking about for a while? Had you considered it
I
for a
had
bit?
thought about it. Yeah, I had been thinking about it for a while. I just didn't know if I wanted to do it. And I sort of was following along to see how other people were doing there. And a lot of people had a lot of great success. Now, they're really great with a lot of different illnesses or pain conditions, phantom limb patients, all kinds of different patients. But for me personally, it didn't move the needle for me. So I did put on some strength, but as far as what I need is more joint stability, and I don't have that stability still. And so I came back in a lot of pain, and also came back with some new illnesses via lab work, and had to be treated when I got back. So there were some gains as far as muscle and working muscles I hadn't worked before, but as far as overall function, I didn't get to a new place. I gave it a long time. At first it was going to be just between 3 and 4 months, and I stayed 11 because I thought, you know what, I'm just going to give it everything because I want to make sure.
Right.
And I did not get where I want to be, and so I'm back here doing some physical therapy. But, even my doctors are like, this is not sustainable. You can't, I can't just keep treating these areas because I'm not able to support it afterwards. So then we keep repeating, treatments in the same areas, but that's not great for your body to keep going through that because you build up scar tissue and, Anyway, so it's really difficult. It's hard to know what to do. I'm looking into something called hydrodissection. So I think that's my next move. That's for nerves, but I don't know anyone that's done it. And I guess I don't mind being a guinea pig.
What do you do? What did you do at the clinic that you feel like, even if it was incremental, what did help you? Like you said, you had some muscle gain. So what was it that you were doing that helped in that regard?
They have a exercise protocol with some lasers and some muscle stim machines that you do with the exercises. So it was helpful. to gain that muscle. It was supposed to re-educate my nervous system. But I don't know that my nervous system changed much.
Okay.
Yeah, unfortunately.
And
but for other people, it works. So I don't want to say that these types of programs don't work for people. It works for a lot of people, right? It doesn't work for everyone.
Yeah, I'm sure.
And you know that going in.
Yeah.
Yeah.
Yeah, I'm sure each individual has a different experience there. And then
absolutely.
You ended up coming back with more things than you went with.
Yeah, well, I came back with a new strain of Lyme, mono, babesia, which I'd had before, but this was a new infection, and I also had a positive Bartonella, which if anyone's out there and you think that you need to contact a infectious disease doctor but don't have access to an ID doctor, go see a travel doctor. And a travel doctor is not a doctor who goes to hotel rooms. A travel doctor is a doctor who deals with anyone who's been somewhere. So they know what is endemic in certain areas, and they know how to treat it, and they know what to be looking for. And I highly recommend anyone who, even if it's just a different state, you don't have to leave the country to go see a travel doctor. A lot of people think, oh, I need to go get the malaria pills because I'm going to, the jungles of Borneo. No, you can go to a travel doctor just because you've been to the South. You know, or just because you've been to the West Coast. There are certain illnesses that happen in all places, and they know a ton of stuff. And instead of going to my ID doctor when I got back, because they charge a fortune and I knew it was going to be a whole rigmarole, I was like, you know what, I'm going to try a travel doctor and see what he says. And, he was able to take care of all the medication, look at the lab work, and it was really quite easy, and I highly recommend it. If you can't get to an ID doctor, and not everyone can get to an ID doctors are hard to find for most people. So that's actually an important takeaway for anyone wondering why they're sick. Oh, sorry, I just lost light. I'm trying to plug in my computer.
That's right.
You're like, where'd she go? She was just here. Anyway, it's so hard for people to get that kind of care, and it shouldn't be, but it is. Because I can't tell you how many times I get asked, like, who should I go see for Lyme? Who should I get? And it's hard because a lot of people can't get into the doctor they want to see, or it's going to cost them $2,000 to see the doctor that they want to see.
Right. Well, I'll tell you that when I was going through it, the best advice you had given me, which ended up helping, was that there's more than one Lyme test.
Yeah.
And that is what, I had been given the one, whichever that normal first one was. It was coming up negative. I still wasn't feeling right. So getting
Did
that...
it come up negative, Albert, or were there certain bands that weren't considered CDC positive?
See, that I don't know.
Yeah,
I basically was at a doctor who he's not a doctor anymore, but but be that as it may, he was just kind of, I don't want to be insulting, but he was just kind of like mainstream, gonna do what the protocol was.
Yeah.
Didn't seem open to like any kind of diversion based on how I was feeling. And I ended up finding a guy who was open. And when I brought up to him, hey, I've been given this first test 2 different times, but I found out through somebody that there are other tests.
Yeah.
And he goes, oh, well, let's give it a shot. And then that's eventually what got me down the road to getting medicine that I needed.
Yeah.
So that's...
Honestly, you should be able to tell, cause this time around, I was feeling achy, I was having fevers, I didn't feel right, and I just asked my rheumatologist, I'm like, I told him, I said, I had a tick, can I have 2 weeks of doxy? And he's like, sure. And then I went and got the lab work. because I knew something wasn't right. But I think that's valid. I mean, I think if you're a person who thinks it could possibly be Lyme, like if you have a next Lyme flare or whatever, it is perfectly reasonable for you to call your doctor and say, look, I had a bite. Can you give me 2 weeks of doxy? And there's usually no question. It's supposed to be 20 days, really. That's the protocol, is 20 days. But a lot of them only give you 2 weeks. And sometimes you just don't want to push. Sometimes you just want treatment, you know. And then get the lab work. But don't wait around till it gets worse. Get on doxy as soon as you can, because you'll less likely to have, you know, late Lyme or, you know, Lyme that lasts forever.
Yeah, and that was the weird thing about it at that time, was that they just wouldn't do the doxy. They were throwing,
it is weird, because it's not like you're asking for opiates.
No, and that's the thing, is they were throwing pain pills at me like M&Ms.
Right.
But he wouldn't do it. And I'm like, what's the harm? And eventually it all worked out. But I still think back to that.
Antibiotics are a natural anti-inflammatory. A lot of people are on like low dose antibiotics for inflammation. So it works for pain as well. And so does Cortif, which is hydrocortisone, which is great if you're a person who has like chronic fatigue and pain. People forget about these drugs, and hydroxychloroquine's great as long as you don't have heart issues, because it can cause long QT. But, you know, there's other medicines besides opiates that work wonders, work way better than opiates. To me, opiates have never been a great painkiller. I like anti-inflammatories, but a lot of people can't take them because of their stomach, which means Cortif or hydroxychloroquine or a low-dose antibiotic is, you know, perfectly good medication to use for pain. Yeah, a lot of people don't realize that.
So do you feel like the new things that you had come back with were a result of where you were?
I'm so sorry about this light.
No, it's okay.
It's like I'm at a disco. I don't know why it keeps going out.
Is it attached to your computer?
No.
Oh, okay.
No. So I don't know. I don't know how I got it, because I was wearing a mask. Nobody else was. I should have been the safe one. You know, I wasn't eating inside. How did I get mono? You know, it's totally weird. You know, I don't know. Some people brought their pets, so maybe I got it from a pet. I mean, there were some times my mask was off for certain things, but just not that often. But yeah, sure. I mean, aerosols live in the air. I don't know.
Gotcha.
Yeah, no one seemed to have an answer as to how I got Babesia mono and a new Lyme strain that I didn't have before. But here's the thing, like on your Lyme test, sometimes they'll say it's negative, but you will have been positive for a couple strains, but they'll still say it's negative. It's not negative. You have those strains. And if you Google those strains have symptoms. And you can look at those symptoms and go, oh, do I have those? Even though my doctor said my test is negative, this strain came up positive, but it wasn't considered CDC positive. Now CDC has removed that. Now a positive test is a positive test, allegedly. Most doctors are still going to read it the way they always read it, because hard to change habits, right? And education. But yeah, if you have even one positive strain, that can affect you.
Yeah.
It can make you sick. So you don't have to have I had the 5 CDC positive, but you don't need that to be sick.
And can those strains kind of sit dormant for a while, and maybe you don't feel symptoms for a while?
Any Lyme can sit dormant and not come out till you have like maybe stress in your life or a surgery, or who knows, you know, why it'll come. But yeah, they evade, you know, it's funny. I don't know if you know much about staph infections, but staph infections also can hide from the immune system, which is exactly what Lyme does. It will hide. and then you get worn down, it comes out. So like staph is living in a lot of people's bodies. They're not sick from staph, but you can become sick from staph the same way you become sick with Lyme. It can hide from the immune system for a while, and then it pops out and it gets you.
Right.
It's weird. But why are we so easy to treat and look for staph, but we don't with Lyme, even though they act the same way in the body? You know, as far as, because they'll just be like, oh, you have a negative test. No, doesn't mean it's negative. It just could be hiding.
Right.
You know, yeah. So it's interesting.
Yeah. What do you feel like there's a long way to go in terms of treating Lyme and kind of accepting it as like the big problem that it is? Do
For
you think
sure.
there needs more attention?
Yeah, because I mean, you talk to certain health professionals, and if you say the word Lyme, they kind of like roll their eyes. I mean, it's so dismissive of the patient experience. I mean, it's like, it boggles the mind that we have to try so hard to get treated. It shouldn't be that difficult. You shouldn't have to know more than the doctor walking in and what to expect. And then if you do act like you know, then they think you're being problematic, you know, or if you look too nice, they think there's nothing wrong with you, that you're just there looking for drugs. If you look too sloppy, they think, you know, you're dehumanized. You know, it's like there's always a thing. You know, I don't understand. But it's complicated for people out there getting healthcare. I've heard every story imaginable. It's, you know, it's unfortunate.
And what do you think, you mentioned this too, I wanted to jump on it, how does stress flare up Lyme?
Well, any stress to the body can, you know, weakens the immune system, and it increases your inflammatory markers. So, you know, that could even be just poor diet too. I mean, your body's under stress from poor diet. Your body gets under stress being outside in the heat too long, mowing the yard, like whatever it is that stresses the body and the heart and the, you know, just its overall function can lead to a flare. I mean, usually you're not going to mow the lawn and all of a sudden you get a Lyme flare, but if you're out mowing lawns maybe every day, you know, maybe your body isn't made for that, you know, and it's too much stress for it. I mean, we're all so different, but, you know, just having a surgery can be really hard on the body. You know, people get surgery and they get what's called CRPS, chronic regional pain syndrome, you know, from an injury or a surgery, or they go in fine, and then all of a sudden, you know, parts of their body feel like they're on fire, and they're in terrible, terrible pain, and nothing can touch, you know, that knee or foot or hand or whatever area it is. You know, and again, that's just a stress response from the body. The body was not made to have whatever happened to it. You know, it's scary because a lot of people have elective surgeries and you really don't know what's going to happen afterwards. You know, so a lot of us are lucky that we get through any surgery, or people who just, you know, had a crushed ankle and they need to have, you know, it pinned or whatever. I mean, whatever the surgery may be, you know, back surgery, throat surgery, CRPS can happen anywhere in the body. So, I mean, you got to think, we got to really think before we allow people to do invasive things to us, because you're really just gambling. We're just throwing the dice. People take their health for granted way too much. I always think of the giving tree, Shel Silverstein giving tree. And I think about that with our bodies, because we take so much and give it back so little. And then we get mad at it when it's not acting right. It's like, well, our bodies do a lot for us. We are really lucky it does what it does. So even if I can't do everything I used to do. My body's still doing a lot for me, you know, and I have to be grateful for that. You know, I have to remind myself, but it doesn't mean I don't get pissed off at my body.
Right.
But I do have to remember all the amazing things it's capable of. Which people forget, you know, they feed it crap, they don't give it enough rest, they don't want to exercise, and then they're mad, you know, that they hurt themselves or whatever. But look, if we don't give our bodies the right circumstances to, I guess, grow and bloom, and, you know, we don't nurture it's going to have a hard time nurturing us. But when you get something like an illness, that was not your fault. You know, it's not like you were just not treating your body well and you got a tick bite or a flea bite that, you know, was carrying whatever virus, or a horsefly bite. Because, I mean, Lyme and all those things don't just come from ticks. You know, it's not like you were out doing something ridiculous. But I'm just saying, in general, we got to really not take our bodies for granted.
Yeah. And with Lyme, generally, most folks are just doing what they do. They're living their lives, and then boom.
Yeah, well, I mean, if you have a pet, you know, your pet can bring it in on you. I mean, it's really important, too. I mean, people should Google how to remove a tick correctly. A lot of people don't do it right. Don't just be pulling them off, you know, because you can leave more bacteria. It's a whole thing, and we're just not told, and we should be.
Yeah.
You know, it's important.
And there have been, like I've noticed up here, it's more rural areas, maybe it's understandable that there have been certain things outside of doctors, outside of the medical world. There have been private little groups that have been putting more interest and more attention into ticks and Lyme, to the point where I wish it was an ability for me to get a picture of it, but it was like a kind of a road that wouldn't have been safe to pull over. But I had seen two gray pickup trucks parked on the side of like a typical 2-lane road through the woods up here, and they were both gray pickup trucks emblazoned with big red letters of tick and Lyme research. And they were pulled along like it was a very rural road. I don't know what they were up to. This was very recent. I hadn't even had the chance to like dig into it. But when I seen it, it gave me like this little moment of like, okay, maybe somebody is looking into some things up here. Because up here is crazy. Like you can look at a tree and end up with ticks on you in certain places up here, especially since I've even noticed since the winters have become more mild. Yeah, that not all the bugs, but the ticks in general. A buddy of mine and his girlfriend, we got together on Saturday night. We were hanging out, and they went for a hike, and each of them pulled 4 ticks off themselves. Now it was like they came home, they were on top of it, and they got them the hell off of them. But
anytime you have a tick, always get antibiotics immediately.
Okay.
For every tick bite, go on antibiotics every time.
So even if, just to like put it out there in these terms, even if a tick doesn't embed itself, there's a chance you could pick something up.
If it's attached to you, it bit you.
Right. And even just a simple bite like that. Well, that's good to know.
Yeah. No, it's not. There's no time limit. People used to think, oh, it has to be attached for 3 days or whatever for it to be an issue. No, it's on contact that bacteria is transferred.
Okay, now can the same be said for other bugs too?
Yeah. Oh, you mean like fleas and horsefly? Yeah. That bite. Yep, for sure. but they're not as common. People don't treat it as common, but anything that can bite an animal and bite a human can carry that bacteria.
Right.
And so like the babesia I had, also called babesiosis, was known mostly as something, I think, that happened in the Midwest or whatever, but now it's creeping because bugs they don't just stay in one place. People think, oh, well, ticks are just on the East Coast. No, ticks live everywhere. They can get on an airplane, they travel. Right. They can take a cruise.
Right.
But yeah, so these, different ticks with these different illnesses, they're everywhere. It's global. But I mean, they even find live ticks in Antarctica. You think they don't live in ice or snow, but yeah, they can. So you can't escape it just because of location or believing you live someplace that doesn't have ticks. That's just not a thing.
Right. So now, for folks who may not be as familiar with it, I'm not super familiar with it myself, but the second illness you mentioned, that's also like insect-borne?
It can be tick transferred, yeah.
Okay.
Yeah, usually it's because, a lot of times it's if you've been around pets. For some reason, that's more pet, but I don't know why. That's just what the doctor told me. He's like, have you been around pets? I'm like, well, there was a dog where I was, but I didn't pet it. I didn't, because I'm totally afraid of all pets at this point, because I am afraid of getting anything from their saliva or, if they have ticks or fleas or whatever. So I don't even pet pets anymore. And I love pets. I'm someone who who's worked at a zoo. Like I love animals. It kills me, but it's too risky for me at this point. I don't want to get sick. So I don't know how I got it. But he was like, have you been around animals? I did want to make sure we gave proper credit where credit was due for inspiration porn, because it was the girl who came up with the label. She passed away, but she coined it in 2012, and her name was Stella Young. So if people wanted to Google more about inspiration porn or understand more about it, or disagree with it, whatever, that's who came up with it. Again, her name is Stella Young, and she did pass away.
And what was her illness?
She, let me see if it says, because she was confined to a chair, and does it say what she had? I mean, I've read what she had, but right now for some reason it's escaping me. I can't remember what she had. But I think it's important that, she brought that kind of, the idea that, we're not substandard just because there's something wrong with us. It's not something people were really talking about in that way at that time. And it's funny because I wasn't even really aware of that term that was coined, but I know that I've always thought about it in that way. Like, why would you think of someone as less just because they were born differently than someone else? There's, it's just so. I always thought that was such a strange idea. So I was glad when I came across that term. I was like, oh, that makes perfect sense.
Right.
They're not there to make you feel good about yourself.
Right. Well, you're either give like you had said earlier, you're either giving able-bodied folks if they could do it, I could do it, and I could also see people who are non-able-bodied either feeling bad about like, oh well, they're elevating this one person to the Olympics, so to speak, just to use the Olympics as a random reference. And this person either can't do that or is going through something where they don't have the fortitude to do that. Or they're in, like, they don't, like, even, like, no, we're not all the same.
Yeah.
You know.
Well, even with Ehlers-Danlos syndrome, first of all, you know, everybody wants to say they have EDS lately, sorry, and some of us do, but it is a genetic illness. And some people are hypermobile due to an infectious reason or an adrenal reason. And I feel like everybody's trying to own Ehlers-Danlos right now, and it's like, you may not have EDS. Like, some people want to buy into that they have this illness, but that, just because you have that diagnosis, adrenal reason that is causing hypermobility, you need to treat that. Like, we cannot just assume everyone has a genetic EDS, because most people are not getting genetic testing. They're just getting a clinical diagnosis, which is a little crazy because you could have other reasons going on. You could also have EDS and infectious and an adrenal thing. Like, you could have all of them going on, right? So we do need to be more careful about that. That upsets me. But even in the EDS community, if you look on some of the EDS pages, it shows you, oh, I have Ehlers-Danlos syndrome, but I'm, you know, this really superstar ballerina or gymnast or runner or whatever. And it's like, this is not reasonable, right? It makes you feel as though, as a patient, oh, I should be able to go run 20 miles. But no, I can't. Like, to me, it's harmful. It is harmful when we show people who have a condition that is said to be the same as ours, doing things that we know our bodies cannot do, or if we did do it, would surely end us up in the hospital. So why are you showing us the exceptions? Show me someone who went to the mall for a day, you know, and got to go shopping. Show me someone who got to type on their computer for an hour. Like, that's where I am with this. Show me someone who got to, you know, carry a bag for, you know, 3 hours on their shoulder without their shoulder being flared for the next 2 weeks. I don't need to see a ballerina or a gymnast or a marathon runner or a long distance bicyclist, right? Don't show me all these, like, amazing people. Great. Just show me, like, day to day they got to wash their dishes. Like, show me that person.
Right.
You know? They went up 2 flights of stairs. Show me that person. Like, you know, that's where I'm trying to get to. You know, don't show me the marathon runner. That's not helpful to me. You know, I need to know that someone with what I have can get better just by stabilizing their joints, because they keep saying, oh, you need stabilization. Well, show me that person that got stabilized and now lives a normal life.
Right.
Normal. I don't need exceptional. Show me normal. That's how I feel.
Now, I'm sure there are levels to these illnesses, to where there's somebody out there who, unfortunately, would never have the chance to achieve a long distance run or a bike ride.
Right.
So are there levels of severity to it?
Sure, yeah. Oh, yeah. And there's also so many different classifications, right? You could have vascular EDS. You can have, you know, there's different, there's like, I think 5 types. They keep changing it. So is it 5 types right now? I think. So it just depends on which type you have. But still, it makes you feel as though you're not doing enough. And that should not be the case. And anytime I bring that up on any of those pages, I get attacked. People get so mean. I mean, I'll get some support, but people get really nasty about it. Like, what's your problem? Why can't you just be happy for someone? Because no, I'm perfectly happy for them.
Right.
But this is not reasonable. Like, I don't want people with EDS going out there and thinking they need to start training for a marathon. To me, this is dangerous, right? This is dangerous to put out there. That is my point. And if no one else is going to say it, I'm going to say it because nobody else is saying it, and I'm afraid someone's going to hurt themselves. I feel like there's a certain responsibility to remind people we are not all going to become runners or gymnasts or ballerinas. And sometimes just getting up a flight of stairs is enough. So let's think about that before we allow people to go out and try to do things that their bodies cannot support and cause further injury down the road. You know, it's dangerous. It is dangerous that they put those kinds of images out there, but they make it look like just because you have this doesn't mean you can't do that. Yeah, it kind of does.
Right.
It kind of does mean I'm not going to be doing that. I have doctors that say, do not do that. So, you know.
So in the same vein, you had sent me a link just before we jumped on here.
Yes.
About cripple punk.
Right. So that was a movement in the same way that inspiration porn is, saying that, look, just because, you know, someone has a disability doesn't mean that, you know, they have to look just like everyone else.
Mm-hmm.
They can be punk rock. They can be, I mean, I don't mean to say it this way, but it says it online too. You know, they can be punk rock, they can be drug addicts, they can be assholes,
right.
They can be nice, they can be helpful, they can not be helpful. Like, just human beings, like anyone else.
Yeah, it seemed to me like just...
Nobody owes you anything just because they have a disability, you know?
Like, someone has something, and they're just integrating it into who they would have been anyway. It's just part of who they would have been, and now with this.
That's who you are, you know? You're what you are, you know? It doesn't... Just because you have a disability doesn't mean, you know... You're not a jerk. You can be a jerk and have a disability, you know.
Yeah, and I think that sometimes, like, those kind of messages need to be a little bit more in your face. Like, I know we don't tend to use the word cripple anymore, but sometimes, like, a moniker like cripple punk can hit you in such a way that make you pay attention to it.
Or some people, you know, want to own the words, right? Like, there's, I don't know if you saw on, I think it's Netflix, it's called Crip Camp. But it's a camp that's made for, you know, people who are, you know, crippled. And so they call it Crip Camp. And that word makes a lot of people uncomfortable, right? But why? You know, we have to think about that. Like, why is that making you so uncomfortable if someone else is comfortable saying it for themselves?
Right.
I mean, it's all up to the individual. Just like I don't like, I'll call it the B word, but I don't like that word used for women in general. But I know a lot of women who think they've taken ownership of that word by, you know, I just disagree with it. I feel like the more that it gets used, the more it perpetuates misogyny. But that's, you know, that's just me. Yeah, everyone is different. That's why we need to ask people.
Right. Well, before we wrap up, Ella, was there anything else that specifically you wanted to touch on while we're here?
Trying to think.
No, we talked a little bit about the cost of disability. I don't know if we got as deep into that as you wanted to. If you wanted to go more into that, and the difference of male and female, and that cost too.
Yeah. Well, I mean, look, having a disability is expensive. Trying to get treatment is expensive. A lot of people don't have the right type of insurance. That clinic I went to, I mean, that was all self-pay. Your insurance doesn't pay any of that. And to get funded for something like that, a lot of people have to, you know, resort to churches or GoFundMe's or, just tracking down getting the help you need, or even finding doctors that know about your condition, can mean flights to different states, for some people, different countries.
Right.
If anyone out there thinks that someone who says they're sick and is having to go get treatment is doing it because they want attention, you are out of your mind, because none of this is easy. It's humiliating. It's hard. It's time consuming. It sucks up our lives. It sucks up our finances. It sucks up time. There's no benefit. If you think me taking a wheelchair at the airport somehow I'm getting away with something special, you're just wrong.
Right.
Usually I have to. Lots of times they don't ask you if you have to go to the bathroom, so you just get the wheelchair to and from the gate. So I don't drink before I get to the airport, so that I'm dehydrated, and don't have to pee the whole time that I'm traveling. If you think that's some kind of benefit,
right?
It is not. The rest of you get to go to, wherever you want or around the airport.
Mm-hmm.
That's not everyone. Not that hanging out at the airport is some great gift, but they have gotten better. The airports.
Okay.
A lot of times I get wheeled past things. I'm like, oh, that looks nice.
Yeah, that's new.
Yeah.
So, yeah, I haven't. I can't even remember the last time I was at an
The
airport.
last time you were at an airport.
Yeah, it's been a while.
They've made them better lately.
Yeah, I think my last flight was, I flew to Denver over 10 years ago. So,
Oh wow.
yeah.
You gotta.
But so in that regard of the cost, what are some things in your experience that folks might be able to? I know it probably varies per illness or per what someone's going through and the severity of it. But what are some things that folks can do for themselves? I'm sure diet is a big thing. Hydration
Look,
is a
even
big thing.
foods are expensive. A lot of people
Right.
are on special diets. Those diets can be expensive that help, manage their illness.
Mm-hmm.
If you have mast cell issues, or if you have IBSM or IBS or IBD, Crohn's disease, even diet can get expensive. But, just buying mobility aids is something that a normal person doesn't have to do. But as far as buying mobility aids, check your thrift stores, check your Goodwills, check your Salvation Army. You can usually buy crutches and stuff for really, really cheap. People give up their canes, or people who had mobility aids, at one point don't need them anymore for whatever reason. That's a great way to save money on trying to buy those items.
Gotcha.
For sure.
Yeah. Well, all right. If that's if we covered it all,
Yeah.
is there anything else that you'd like to talk about or bring up?
No, I don't think so. I feel like I probably didn't explain inspiration porn as clearly as I would like to, because for me it's sort of a complicated discussion, because it can go both ways. Some people do benefit from feeling like they are seen because they are disabled, or have a need for special help or whatever, and for some people it's a qualifier for them in getting what they need. So we can't always say that just because someone's in a wheelchair or whatever that there isn't a benefit of being seen and maybe being seen with a need, whereas other people don't want to be seen with a need. They just want to be seen the way everybody else is seen.
Right, not be othered.
Yeah. Because you are othered, right?
Mm-hmm.
As soon as you're seen, oh, that's the guy in the wheelchair, or that's the guy with the, whatever, or the girl, that walks with a limp, or whatever it is. It's like you are othered immediately. But sometimes it's a good thing to be othered. When I'm at the airport, I would prefer to be othered so that I don't get the side eye and oh, it's a miracle you can walk. Yeah, I can walk and I can stand, just not for very long. And so therefore I take the wheelchair. You know what I mean? Like, I've read articles, about this kind of thing where people don't believe that, you need a wheelchair at the airport, and they call them like airplane miracles. As soon as they're off the plane, they can walk. Yes, but they couldn't walk 5 miles through the airport. Just because you can walk to the car once you get your luggage is not the same as standing in security lines and walking. Airports are sometimes gigantic. So, sometimes it is good to be seen as other, but a lot of times it's used to objectify and make yourself feel better, and that is where we go wrong with it. Just want to make that clear, that sometimes it's good to be othered, but not in the way of making you feel good about yourself.
Right, and I guess not in like a too much of a fantastical way.
Yeah. Or like, I did this really good thing today. I helped someone who was on crutches, or I helped someone, like, that wasn't there for you to feel charitable.
Right. And I guess even like seeing, it would be easy for someone who just simply didn't know better to see one person with an affliction do something and then expect, oh, well, Ella, why can't you run that marathon? So-and-so did it. Why can't you do so-and-so did it? And I could see that kind of happening too, of people not understanding or putting one person's success on somebody else. Like, well, they did it, you should be able to do it. Push yourself harder.
Sometimes you'll see the person who's homeless who also is valedictorian and then headed to Harvard, and you think, well, I had a house and I had a regular life and I didn't study as much as that, but it's like, no, this person's clearly a brilliant person.
Right.
Take the rest of it out of it. They're an exceptional person just because they're an exceptional person. The homelessness didn't make them the exceptional person, right?
Right.
I mean, that's not fair. They're exceptional because they're exceptional. And some people are exceptional because they're exceptional. That's it. Regardless of anything else that would seem to someone else to be something that stands in their way.
Right. Yeah,
it didn't stand in their way.
It makes sense to me.
What's that?
No, I said that makes sense to me. Like putting it in those terms makes sense.
Yeah.
Because it's and I the more I thought about it leading up to this morning, like you could in a sense it can apply to even outside of the disabled community, of just boiling it down to, this person did this, why aren't you doing it?
Yeah.
And
because we're all made differently.
Right.
We're all different.
And to take that and then lump it on top of people who physically can't do things, I'm sure it sucks to be in that position.
Yeah. Yeah, but you can always hear it in people's voices when they go to help someone. Like, oh, do you need that? Oh, do you? It's like, why are you talking to them like that?
Yeah, no need for the tone shift.
Right. What is that? That immediately tells me you feel sorry for someone for their circumstances when they're not feeling sorry for themselves about their circumstances. Well, what are you doing? It's bizarre. No one wants to be treated like that. I'm not your pity case. I'm not your... Right. No one wants that. That's ridiculous.
Yeah, exactly. Yeah, they don't... Like, it's the same tone that they... Like, if they're talking to their pet or a baby.
Or child. Or,
yeah.
Yeah, exactly.
No, I've heard it.
Yeah.
Yeah.
That's exactly right. Just be normal, everyone. Just be normal.
Right.
Guess is the message here is talk to people the way you would talk to them, no matter what.
Right, and treat them in the same way.
Yeah, I mean, let's try to be nice to people, but look, if you're a jerk, you're a jerk.
Yeah.
You don't get extra credit just because you weren't a jerk one day to someone.
Right, you gotta maintain it.
Yeah.
You gotta maintain it every day.
Right.
Well, cool, Elle, this has been fun. We're about out of time. But,
Okay.
I'm glad we were able to do this. It was good to catch up with you.
It was good to catch up.
We were saying beforehand, it's almost a year to the day since 2020 when we did our second episode of the podcast.
It'll be 4
together.
years, right?
Yeah.
4 years to the day.
Yeah, 4 years to
Yeah.
the day.
Yeah.
And are you still active on social media? Where, if so, where can people find you?
So I took a little time off. I'm on Instagram here and there. Just I'm not as reliable as I used to be. I do have a website, but the last time I looked at it, I realized there was a lot of errors, so I need to go back to it. But it does post podcasts that you and I have done and articles I've written, and some information there. It also has a link to my Instagram page, which for anyone who's sick or has questions about chronic illness or Ehlers-Danlos syndrome, lots of free information between my website and my Instagram page. Feel free to peruse it. I don't always get to questions. Hopefully, if you scroll long enough, that question will be answered.
Okay.
So just keep looking and swiping through my page, and you should get an answer about something on there.
Okay, cool. Well, I'll put those links in the description and stuff, and people can check that out.
Yeah.
And yeah, once again, thanks for coming on the show. I'm just happy to have you on.
All right. Well, thank you, Albert. Take care of yourself.
Yeah, you too. You too.
Okay.
Right, so-
Thank you.
Try a brand new Daewoo from Villa Marin on Forest Avenue, and we'll do our best to meet any deal. Daewoo combines luxury and